Homelessness strategies, passenger rail, and artificial intelligence. These are all items Travis County Judge Andy Brown and county commissioners are tackling ahead of Travis County Commissioners Court tomorrow. Judge Brown joins Jennifer now in the studio with an in-depth look at his priorities for 2024. Jen?
All right, Mike, thank you so much. And Judge Andy Brown, thank you for taking time in your schedule to be with us today.
Yeah, thanks for having me.
Okay, so your two top priorities for 2024, the mental health diversion program and passenger rail in Austin.
Yeah.
So let's start with passenger rail. We have covered mental health extensively. Let's start with passenger rail. So we know that Texas Central, as well as Amtrak, developing a line going from Houston to Dallas with a stop in the Brazos Valley. Now, we know that we are seeing a lot of traffic here in Austin. More and more people are moving here. There's a lot of congestion, and a lot of people want a rail line here, specifically going from Austin to San Antonio. When do we think that something like that could happen? Are there current plans in place?
Yeah, so we've got three great options in my mind. One is expanding Texas Central. So the first route, like you said, would go Dallas, College Station, Houston. Mm-hmm. And so I've talked to them about expanding that sort of in the second phase from College Station to Austin to San Antonio. So that would be high-speed rail, 205 or more miles per hour, and it would get us to San Antonio really quickly. It would even get us to Dallas, I think, in about 90 minutes, something like that. That's a great option. There's also the option of expanding existing Amtrak service on the existing rails between Austin and San Antonio, which we're working with Amtrak on trying to figure out a way to do that. That, of course, means we need to negotiate with Union Pacific to figure out how to do that. Do we build a new train line next to it or what? But that would provide more intercity service so that you could take several trips per day to San Antonio, drink a cup of coffee, not worry about the horrid traffic on I-35. It'd be safer, more environmentally sensitive. And so I've set up a kind of a study group of folks here in Travis County. We're going to have our first meeting soon to look at those two options, as well as looking at Brightline, which is a private company that put passenger rail on a freight line in Florida. It's up and running. I took a ride on it a month or so ago, and they're interested also in this corridor. So that would be a third option for how to get passenger rail between here and San Antonio.
Okay, so several options here. What could be the timeline? Where would the funding come from? Would it be a mix of state, federal, and local funding?
Yes, so the Biden administration has put something like $65 billion towards expanding the nation's passenger rail network, a lot of that going towards high-speed rail. My understanding is that Amtrak and Texas Central are talking and would theoretically receive some of that funding for that high-speed rail if everything kind of progresses as they see it. If we are able to expand Amtrak service, for example, I believe there's a match where the local, state, or community would pay about 20% of that cost, and Amtrak or the federal government would pay about 80% of that cost.
Okay, and now let's shift to the mental health diversion program. You laid the groundwork last year. It's been essentially a year in the making. And so I know that you want this to be an equitable process. You have many community partners that are involved. They want their voices to be heard. What needs to happen to ensure that this gets implemented soon, hopefully by summer?
Yeah, so we're going down two paths. One is a pilot that will get implemented hopefully this spring, and that would be part of it working with Integral Care, hopefully part of it working with the Austin State Hospital. And what we're trying to do there is see how it works. About 25 beds or so space is what would happen, and there would be an intake on Airport Boulevard at an Integral Care site, a sort of longer stay place on 15th Street. And then we're talking to the Austin State Hospital about using one of their buildings that they're moving out of to their nice new hospital that would help us have a place for people with higher intense mental health needs that could have, some episodes of violence or just really intense mental health needs. We don't really have a good place for people like that right now other than the emergency room to receive those services. And so this would be increasing what Integral Care does on Airport to 24 hours a day, working with other organizations to provide peer support services. That's the pilot. And then the longer term, building an actual robust mental health diversion center and crisis care facility like they have in Nashville. They have one in Tucson and Yavapai County, Arizona, and a really big one in Miami. That would involve the city and Central Health and the county and the state and the federal government, hopefully with some grants, to build the most robust mental health diversion center that the state has seen. And so that's what we're working on, trying to make sure we get input from all the partners. We've hired a person at the county, Tyrone Jolly, to be the sort of project manager for this. And so that has several steps which will take a few years, but this pilot should be up and running this spring.
And you just mentioned those 3 places, so I assume you're looking at those as models. Have they been successful? What challenges have they faced that you all anticipate?
Yeah, so Miami, my understanding is when they ramped up their mental health diversion services, providing more mental health to the community to make it a safer place, they actually were able to close one wing of their jail, which I think saves them something like $12 million a year. Because right now we've got our mental health facility, our largest one, is the county jail. And it's got about, by our measure, about 44% of those people have an unmet mental health need, which is double what it was pre-COVID. And so the savings to the community in terms of people actually getting the mental health care they need, but also the real cost of savings of reducing that jail population. When people get arrested because they have a mental health issue, the best thing long-term, like in Nashville, is to go to this mental health diversion center where they spend about 14 days to get stabilized. If they complete that 14 days, their charges are expunged, and nobody is released back into an unhoused environment. They're released in some sort of supportive housing or to a family member. That has reduced recidivism by that population in Nashville by 70%. And so we're seeing similar things in all these counties that we visited. Frankly, it's something we should have done a long time ago. But the great part is there's great examples and great data out there that shows how much money we'll save, how much more our community will be safer because we're giving people that mental health service that they need.
And then, Judge, lastly, quickly, let's talk about artificial intelligence. It is here, whether people like it or not. Can you talk about the work that you've done with the National Association of Counties and the challenges? It was really interesting to me. You all are looking at it through a lens of local governments and really the challenges that local governments face as it relates to AI. What are those challenges? Were there any solutions that you all talked about to tackle the challenges?
Yeah, so we're about 3/4 of the way through this year of the Artificial Intelligence Exploratory Committee. I'm co-chairing it with a commissioner from Florida. And we've met with Google, Microsoft, all the players in sort of the software support services for county governments. And we're trying to figure out what, if anything, does it make sense for counties to use in terms of artificial intelligence. And frankly, there's a lot of red flags there. There's a lot of unknowns of it, but it does seem like there's a ton of potential for crunching data. That seems like something that what we saw with Microsoft and Google, you can feed a lot of data into artificial intelligence software product, and it can summarize that data and help sort through things very quickly. Of course, there are issues relating to the workforce, relating to the quality of that data, and even just on the technical side, where are we going to put all these data centers? Because crunching that much data requires lots of physical data centers. So there's a lot of challenges to it, but it does seem that it is happening with these companies. One thing I noted is that when ChatGPT came out last year, it seemed like it came out of nowhere. But what Microsoft and Google and others tell me is they've been looking at this and working on it, and they've kind of had that technology since like 2018. So it's not quite as big of a shock to them, I guess. And they're looking at ways to just improve some of these software products like Teams or Outlooks or things like that, adding a artificial intelligence component to it, which really means like a big supercomputer that everybody would be able to use to kind of crunch data is the best way I can think about
Explain
it.
Okay,
Yeah.
okay. And then lastly, Travis County Commissioners Court meeting tomorrow. Ahead of that, we want to look at item 30 regarding homelessness and the funding likely allocated to really analyze the homelessness strategies of the city of Austin, Travis County as well. What are some of the things that you have noticed within those strategies that maybe haven't worked and the things that have worked?
Yeah, so there's a proposal from the city that's on the Commissioner's Court docket tomorrow for this. And I think the counties, frankly, the road that we are going down with Central Health, with the city, with the state government and the federal government, as what I see as the very biggest need of our community is more mental health resources. And that's where this mental health diversion center and the crisis care facility come in. Because if right now the situation is if police pick someone up or if someone has a relative that is having a mental health crisis, there are very limited places to go in Travis County, especially if you're low income. The state hospital system, frankly, is supposed to do that, and it's not. There's a long wait list there. And so as a result, our jail is getting backed up and we're having other problems in our community. So I think if we can meet the community's need on mental health, I think that's where the county and Central Health and the city really can step in and change things. And that's, I hope, what's going to happen with this mental health diversion center, both with the pilot and the permanent diversion center once that's up and running.
Okay, Judge Andy Brown, I know you have an 11:30 meeting, so thank you so much for being with us. We truly appreciate it.
Thanks for doing this too. Great in-depth stuff.
Thank you.